U.S. is grappling with millions of Americans addicted to both legal and illicit opioid drugs, mostly heroin, which have been the leading cause of accidental death in the United States for several years. In 2017, drugs killed more than 70,000 people, more than any year on record, according to the numbers from the Center for Disease Control and Prevention that were released in December 2018. Overdose deaths in the most recently recorded data were so high that they contributed to a decrease in overall life expectancy in the United States for the third year in a row, depressing the average age to 78.6 years. The opioid epidemic is a uniquely American problem. Americans consume a disproportionate share of opioids, about 30% of world opioid production, with less than 5% of the global population. Take a look at this chart representing overdose death rates increases from 2016 to 2017. The red states show the highest overdose death rate increases. Americans don't experience severe injuries or suffer from chronic pain any more than Europeans. In France, Italy, and Ukraine, individuals report even higher rates of chronic pain, around 40%, than people in the United States, where about 20% of the adult population, or 50 million people, report some sort of chronic pain. So why the American ever-increasing opioid consumption rate? The increase involves personal expectations, societal norms, medical practices, and the influence of powerful pharmaceutical companies whose marketing tactics take advantage of a fast-paced lifestyle and a fix-it-now culture. Big Pharma has spent billions on marketing to physicians, including offers for free vacations, dinners, speaking fees, and other perks. A new study published in JAMA Network Open examined more than 400,000 marketing payments in the United States for a potential link between physician-focused marketing and opioid-related deaths. The results showed that countries where marketing to doctors was heaviest had the greatest incidence of overprescribing of opioids, as well as subsequent abuse and related deaths. Still, despite the dangers of opioid addiction, many Americans trust drugs to offer pain relief for themselves and their loved ones more than any other therapy. A new study from the American Society of Anesthesiologists surveyed more than 1,000 parents with children between the age of 13 and 24 and found that 2/3 believed opioids are more effective at managing their children's pain after surgery or a broken bone than non-prescription medication or other alternatives. Unlike most countries, the United States allows direct-to-consumer drug ads. We've all seen them. Ask your doctor about drug XYZ, they advise patients. This generates demand levels that are simply not seen in other countries. The United States and New Zealand are the only two countries in the world to permit direct-to-consumer pharmaceutical advertising. A pill may seem less daunting than alternative therapies, and this, generally speaking, is attractive to U.S. consumers. As a culture, we could better work through pain by being more open-minded to non-medication therapies for pain, such as physical therapy and relaxation. As income inequality continues to grow in the United States, experts have begun to look at how social-economic factors might contribute to pain and drug abuse. Authors of a CDC report published in September 2018 found that social-economic status appears to be a common factor in many of the subgroup differences in high-impact chronic pain prevalence. The report found unemployed older adults, adults living in poverty, rural residents, and people without public health insurance are significantly more likely to experience chronic pain, while the risk of pain is lower for people who have earned a bachelor's degree. This could be because the emotional stress of financial insecurity can have a direct effect on one's physical pain level, according to data published in Psychology Science in 2017. This could explain why some of the poorest U.S. states and those with highest unemployment rates, including Kentucky and West Virginia, have some of the highest rates of opioid use and addiction. In addition, nearly 75% of men and over 60% of women are obese or overweight in the United States. This condition can lead to related health problems, including chronic pain. Addressing the causes of pain puts you closer to discovering the cure for pain. Pain is not caused by opioids, therefore opioids cannot be the cure. The risk of opioid addiction is far too high to settle for a quick fix approach to pain management. Perhaps wisdom will dictate to try a regimen of targeted exercises, natural remedies, relaxation techniques, and stress-reducing lifestyle changes first. There are far more pain-relieving choices available than those provided by using addictive drugs. Americans consume about 80% of the global supply of the prescription opioid oxycodone. Does this sound like a healthy choice to you? For more information about addiction, please feel free to contact us at the Institute for Addiction Study. The link is in the description. Together we can find real solutions.